Global Watch on CGTN. Friday marks the World Autism Awareness Day. Autism Spectrum Disorder, or ASD, refers to a range of conditions characterized by impaired social behavior, communication and language. Individuals with ASD often present co-occurring conditions. These include epilepsy, depression and attention deficit hyperactivity disorder. A report by the World Health Organization says 1 in 160 children has ASD. The symptoms tend to persist into adulthood. Some people with ASD can live independently, but others have severe disabilities and require lifelong care and support. However, children suffering from ASD could also be creative and talented with supportive social and attitudinal environments. Sun Ye takes us to an annual art show in Beijing which showcases the works of children with autism.
Jackie has 2 of his paintings featured in this year's Autism Awareness Day art show. His paintings are about sunflowers and more sunflowers. He says they bring optimism. And his mother, Flora Tan, says painting and music trainings have come to bring calmness and concentration.
Artistic training is effective, but the effects come slowly. It takes time for him to find out what he likes.
For 25 years now, mother and son have been looking for ways for Jackie to cope with autism.
There's been sensory integration training, auditory and linguistic treatment, and so on. The training is lifelong, it lasts forever, and takes place wherever possible. We're lucky to be able to afford it all.
She says she hopes the pair will be lucky to stay with each other and grow in the years to come. By 2019, there are over 10 million people with autism in China. Among them, more than 2 million are under 14, and not every one of them gets the attention and training they need. China's leading expert in treating autism, Dr. Jia Meixiang, says the lack of attention is felt even more acutely for autistic people who are growing old.
Our oldest patient is 52 years old now. How much help do you expect the parents to be when their child is this old? That's why we've been calling for a lifelong, all-around support system for autistic children. It should be a system that combines medical, educational, and rehabilitation efforts.
She says more awareness is needed about autism in China because everyone grows old one day. Sun Ye, CGTN, Beijing.
For more insight into this, let's talk to Ms. Xu Honghong from the Medical Psychology Department at Peking University. Thank you very much for joining us, Ms. Xu. So first of all, give us an idea of the situation of autism in China, especially among young children.
Okay. Yes, just as you said, there are more and more diagnosed as autism. I think there are several reasons to explain this. The first, before 1980s, there was no such a thing as autism in China because we didn't know about this kind of disease. After then, we started to recognize it as a developmental disorder. Secondly, the scientific diagnosis method has been developed and widely used, as well as doctors who are more familiar with the symptoms of autism have enabled autistic children to be diagnosed more correctly, which has also led to an increase in the number of autism. And in the 2013 diagnostic criteria, the name of autism was changed to Autism Spectrum Disorder, further expanding the scope of diagnosis of autism. And there are also a third reason to explain why the autism is more prevalent these days. I think it's because environmental factors. Scientists have found that there are more than 100 autism risk genes, but also most of the cases have a complex combination of genetic and environmental factors. For example, chemical substances, air pollution, and food safety are affecting the pregnancy conditions of mothers. In addition, people in contemporary society are suffering great psychological pressure, which may also promote the occurrence of autism.
So, Ms. Xu, this very day actually is called World Autism Awareness Day. So, would you agree that better awareness, public awareness, will help more of those people suffering from ASD? And if that's the case, what needs to be done more in China?
Yes, definitely. I believe the society should improve the public awareness to this developmental disorder and popularize related knowledge, because knowledge is power, so that the children with autism are more likely to be discovered and well treated, not to be ignored or stigmatized. Also, the society and the public health organizations need to support the family with autism children, especially parents who are also suffering from a lot of parenting stress. They need to know where they can find help and find medical resources. And I think for different aged children, we need to give them different support. For example, for preschool autistic children, there should be qualified specialists to give them early interventions, such as linguistic training, social skills training. Although autism cannot be cured, early treatment is of great significance to future social functions and their life well-being. And also for school-aged, integrated education, I think, is highly suggested. Some of the autism children can go to mainstream schools with the support of specialists. And also for teenagers, we need to address the discrimination issues. The ordinary children might make fun of them, and the patients might have depression, anxiety. So we need to give them necessary emotional support. And for adult patients, we need to make public service available for them and encourage them, especially the high functional autism patients, to have kind of jobs. I think all of these are very important.
Thank you very much, Ms. Xu Honghong with Peking University. Last but not least, we leave you footage of several Chinese cities that have held activities to raise public awareness of autism. And with that, we end this edition of Global Watch on CGTN. I'm Pan Deng in Beijing. Bye-bye.